Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about plantar fasciitis. Now, I've talked about this multiple times, but I figured using the board, I could actually show you a little bit more about what's going on and help you understand basically to a greater depth what's going on. So plantar fasciitis is an inflammation of the ligament on the bottom of the foot or the fascia on the bottom of the foot called the plantar fascia. So if you look at this image right here, you've got the Achilles tendon that attaches to the heel or the calcaneus in that area. And then you get the plantar fascia that attaches here. So what plantar fascia is a single band back at the heel, splits to 3, and then splits to 5. So it ends up going out to the toes. And so it covers the whole bottom of the foot. And it's a thick tissue that kind of helps support the foot in that area and so forth. So what's happening with plantar fasciitis? Well, let's look at this view here. You can see that you got the Achilles tendon and the plantar fascia here. When you walk, you get the pull of that plantar fascia and the pull of that Achilles tendon, both on the heel. The weaker of the two, of course, is this plantar fascia right here. So it starts to pull off in that area. So what happens? So let's kind of go into this here a little bit. So as you're pulling off right here, what will commonly happen is you'll get a pull on that plantar fascia and it starts to pull this direction, starts to go that direction, right? And what'll happen with that, make sure and so what happens is then sometimes you'll get a spur in that area. You'll get because that Achilles, that plantar fascia is pulling on the heel, you get a spur. And typically the spur in that area does not cause pain. It's just a symptom. Whereas sometimes you'll get spurs in the back here. They do cause pain. They're a different issue. But because this is parallel to the ground, we don't have to treat the spurs. They're not the reason that you hurt. But what happens in that area is you'll get inflamed right in this same general area, and it becomes more of a problem. So let's move over to this area, and that kind of shows you what's going on. So you've got the Achilles tendon in this area. You get the plantar fascia. It's pulling off, so it gets inflamed, painful, and tender in that area. Typically, it's going to hurt right just behind the arch. Sometimes it will extend out into the arch. Sometimes it can be right center, right underneath the heel, and it causes pretty significant pain, pretty significant inflammation. And what will happen is the plantar fascia or around the plantar fascia will swell itself. So typically what we'll do is we'll do an ultrasound. We can actually look at that plantar fascia and we say, okay, normal is this thickness. If you get double or triple the size, you're going to get pretty significant pain. So the question is, if you have plantar fasciitis, what are you going to do for it? What do you do for plantar fasciitis? There's two pieces to this puzzle. You want to make sure, number one, that you're treating the symptoms, that you're helping reduce the symptoms, help improve that in that area. Number two is once you've got the symptoms improving, how do you keep it from coming back? Most individuals will do the first one and they forget about the second one, or they don't do the first one, they do the second one and try to treat it. So I'm going to talk about both. So the first piece here is treating the symptoms. How do you reduce the symptoms? And there are multiple different ways that you can do that. Icing, stretching, anti-inflammatories are sometimes what people will start at home. Those can be helpful. Basically, you're just trying to, again, reduce that inflammation in that area. In the cases where this is not working, it's not getting enough improvement, then you may need to go some of the other routes. There are 3 that we actually commonly recommend in our office. One is cortisone shots to the area. What's the disadvantage of cortisone? It's a shot. It hurts. You can have side effects from the cortisone. Maybe you'll react to it, those kind of things. That's not important. The truth is, if you've got a plantar fasciitis and you can decrease the inflammation and you don't have any risk factors for these side effects, you'll get some relief over a 4 to 6 week period. The question people ask about the cortisone shot is it going to solve the problem long term? Sometimes it does. Sometimes you can actually get a single shot and it will reduce the symptoms so much that you get back to normal. You still need to go to step 2 where you say, okay, how do I prevent it from coming back? In some cases, it's going to take multiple shots, 2 or 3. My recommendation is you do up to 3 shots. You don't do more than that. But if it improves the symptoms after 3 shots, you don't have to do anything else other than make sure it doesn't come back, right? Go to stage number 2. Second option, we have a form of laser, MLS laser, that actually is very aggressive at decreasing inflammation, decreasing pain, and it stimulates the tissues to heal. I love this because it stimulates the tissues to heal. It's not just treating the symptoms, but it actually fixes the problem. This usually takes anywhere from 6 to 10 treatments. You treat the area, it takes 15, 20 minutes. It works phenomenally well at, like I said, healing the problem. Disadvantage there is insurance doesn't like to pay for it. So we usually work with individuals to help it so it's a little bit easier to get it done. So laser is a good option. The third option, if you're saying, okay, I'm doing some of these other treatments and it's just not getting better, or I've been treating it for a long time and it's not getting better, then there is a procedure that can be done called topaz. And the idea with the topaz, basically what we're doing is we're doing a grid over the area of the most tenderness. So we're going to do it right in that area. Let me switch pens here and we'll kind of show you what we're doing here. And so basically what we do is we find the areas of most inflammation and we actually do, see if I can do it without touching, do little dots. A little grid over the areas of pain. We take a probe through that uses radio frequency waves to create little mini tears in that plantar fascia to allow it to lengthen, but it also stimulates new blood vessel formation and growth factor migration designed to fix the problem. This works phenomenally well. Usually you can walk on it right off the bat. You're in normal shoes within a couple of days and you're getting back to normal activities. It usually takes, however, 2 to 4 weeks to completely heal. Some individuals are slower, some individuals are quicker, but that's the average, 2 to 4 weeks. Those are the biggest things. And then you jump to step number 2. You say, okay, I've done the treatments. I've got it done. How do I keep it from coming back? Topaz does a phenomenal job of keeping it from coming back because it lengthens that plantar fascia. But many of the other treatments, you need to say, okay, I need to change the way I walk. I need to figure out exactly why it's happening and treat it. The most common is to change the shoes you're wearing or to look at inserts or orthotics. That being said, inserts or orthotics do not fix plantar fasciitis. They keep it from coming back. So most of the time you have to do something else initially to alleviate the symptoms and fix the problem. And then you can go into orthotics to really solve the problem. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 330, plantar fasciitis and things that you can do for it.